Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. First up, what we're discussing is why Indian vaccines are not being recognized by the UK. Now, the latest changes in the UK government's COVID-related travel restrictions have upset the Indian side, as travellers who have got both doses of the AstraZeneca vaccine will be considered unvaccinated and will have to undergo 10 days of quarantine. The new rules, which were unveiled on Friday and will become effective from October 4th, under these rules, only people who have got both shots of a double dose of vaccines such as Oxford, AstraZeneca, Pfizer, BioNTech or Moderna will be considered vaccinated, but only from certain countries. Effectively, this means even Indians who've received both doses of Covishield, that's the local version of the Oxford AstraZeneca vaccine, and one of the two main vaccines being used for the domestic immunization program will be considered unvaccinated. Remember, Covaxin is still not considered in international travel. Now, the chief coach of the Indian women hockey tweeted from Netherlands that he had to undergo vaccination again as his Indian Covishield was not recognized. You can see that tweet, his third vaccination done since Covishield is not recognized here. He's like, it's really unbelievable that 1.3 billion Indians have been vaccinated with Covishield and we just can't get it here to approve. Also, Jairam Ramesh, Congress leader, reacted to this news, saying it's absolutely bizarre considering Covishield was originally developed in the UK and the Serum Institute, Pune, has supplied to that country too. This smacks of racism. And Shashi Tharoor has cancelled programs in the UK because of this. He tweeted, "Because of this, I have pulled out of a debate at the Cambridge Union and out of a launch events for the UK edition of my book, Battle of Belonging." He says it is offensive to ask fully vaccinated Indians to quarantine. The Brits are reviewing it. So that is what he has claimed. So what can be the reason behind the fact that these vaccines are not considered? Now, what we can tell you is back in August, the World Health Organization had said that it had identified counterfeit versions of India's primary COVID vaccine, Covishield. In fact, after that news came that WHO has flagged concerns about counterfeit versions of the vaccine, the center had then sent out a warning to all states to take action against fake Covishield vaccines and even said that they were conducting an inquiry into this entire matter and that all states and they shared parameters to help identify genuine vaccines with all states. Well, to talk more about this, we're joined by Dr. Veer Pushpak Gupta, physician, National Health Service. Thank you so much, Doctor, for joining us on the program. So please explain this to us because it's created a lot of outrage here in India. Many, questioning whether this is racism and why would UK not recognize the Covishield vaccine, which is the same vaccine that has been used in the UK as well, the Oxford AstraZeneca vaccine.
Yes, thank you for having me on the show, Gargi. Look, I absolutely agree with the anger that is there amongst the Indian public and also the Indian hierarchy and the government against this bizarre decision. I mean, it's absolutely bizarre why certain countries are being allowed the same vaccine and certain countries are not being allowed. And especially a country like India that has vaccinated more than 80 crore people, which is a very large number, second only to China in the world that has vaccinated their own people at such high numbers. Producing a UK vaccine in India, in the Serum Institute, and not being recognized as one of the vaccine that can be approved. It's bizarre. Let's look at what the UK has come out with. So the only countries that are allowed to not quarantine with the same vaccine is either the European countries or the United States, the UK, and certain countries in the Middle East. Now, even in the Middle East, there's a discrepancy between UAE and then other countries like Bahrain, Kuwait, and Saudi who are being approved, but UAE is not being approved. So I'm not sure what thinking has gone behind this kind of policy making, but the three biggest nations that are vaccinating their people, Russia, China, and India, have all been left out of this kind of, whatever protocol that they've made. And it only reeks of vaccine colonialism. That's the only word I can use because, certain countries in the West are being allowed with the same vaccine and the countries in the East are not being allowed. And I think that we need to sort of bring this up in the way that it's being brought up. Diplomatic channels have to be used. If you remember, India was on the red list for the longest time, and there was a lot of noise made about that, and India was taken off the red list afterwards. So I think this has to be brought up to the highest levels. And I appeal the Indian government and Indian missions abroad to sort of bring this up and make it easier for Indians to travel to the United Kingdom and other Western nations.
Right, Dr. Veer Pushpak, what we do know and what, this point that I made was that we do know that the World Health Organization had earlier flagged counterfeit vaccines. They genuinely found in some countries in Africa and in Asia, they found, counterfeit Covishield, which was checked by the Serum Institute and found to be counterfeit. And after that, the Indian government also reacted. There was this letter sent out from the center to all the states to identify if there are any such, counterfeit vaccines, fake vaccines, and also that an inquiry would be done. So is it possible that this is the reasoning behind this, that, do they feel that perhaps because the WHO flagged this, that's the reason for now that they've, made these rules for Indian travelers?
Counterfeiting of vaccines has been an issue all around the world. It's been an issue in many countries. One of the ways that we've tackled it is that we have specific batch numbers of vaccines that are used, and those batch numbers are then put onto the database that is being used to collect the information of people that are vaccinated. And then that database is used to see through the app, like CoWIN app or the NHS app over here, whether the person has been vaccinated with the correct batch number or not. Now, I'm sure that is being used in India, but however, people find a way to counterfeit things. They find a way to get around it. And I think, of course, that needs to be cracked down on very strongly. But as you said, this has been taken seriously by the government. It has been cracked down on. And I don't believe that the countries that have been left out of this policy have been only left out because of this reason. Because if that's the case, then why are countries like UAE being left out? Clearly they have a setup which is of international standards and are using vaccines like Pfizer, Moderna, and Johnson & Johnson and AstraZeneca. So why have they been left out? So it doesn't make any sense. I don't think this is a particularly targeted thing at India or at Indian vaccines. I think this is generally a sort of division between the Western countries and the Eastern countries. And that's why I use the word vaccine colonialism, because I feel that, this is what it is. It's discrimination based on where the vaccine has been given rather than where the vaccine has been made or which company the vaccine is from.
Right, and hopefully India will work those diplomatic channels to ease this sort of issues that Indians face when they'll arrive in the UK. So currently, and these rules come into effect on the 4th. So currently, what are the rules in UK and what is the COVID situation?
So currently the rules are that you have the red list, the amber list, and the green list. I think that those lists are going to be scrapped from the 4th of October. And India is on the amber list. So everybody that comes from India will have to quarantine for 10 days and will have to do the day 2 and day 8 tests, which are quite expensive. And, quarantining and sort of the costs of all of these things will add up. Of course, they don't have to do the hotel quarantine as they had to do previously when they were on the red list. And that has obviously helped a lot of Indians, especially Indian students that are starting their terms in universities in London and all over the United Kingdom. This September, universities have opened up. So it's made a huge difference. Again, Indian diplomatic channels were used. I was on NDTV. We talked about this issue and India was taken off the red list. And I think that we need to do that again. In terms of the COVID situation at the moment is quite stable in the UK. I would say that we're having a daily case numbers of, it's much decreased than before, but about 20 to 30,000 cases. However, the hospitalizations are very low. ICU admissions are very low. The main ICU admissions that we are seeing are in unvaccinated youth and unvaccinated pregnant women. And those are the main cases that we are seeing in the hospital. Otherwise, the vaccinated people are being protected. There's sufficient antibodies in the society and in the community itself to protect people from the virus. So far, so good.
Right. And doctor, what we do know is that vaccinated people can also carry the virus and pass it on, because that's been an understanding. And do you think, but the example in UK, the fact that it's not, that the numbers have come down, those going to hospital have come down, and given that a majority are vaccinated, that this shows how this disease will eventually become endemic?
Yes, I think so. And I think, you can see both the numbers and the point that you made is very, very true. Vaccines will not protect you from getting the virus. You will still have cases that are increased because we're having 30,000 cases every day. That means 30,000 people daily are still getting COVID and testing positive for COVID. However, not all the 30,000 people are ending up in hospital and ending up in ICU like what we were seeing before. If you just take Google and you look at the numbers in December in terms of deaths and hospitalizations versus the numbers now, you will see that it's come down significantly. I mean, in December, we were having about 1,500 people dying every day. Now we're having about 100 to 150 people dying every day, which is still a significant number, but very, very much improved than it was before. And I think if that is not a proof that vaccination works, then nothing is. And the only way out of this, we've been saying this for months, the only way out of this pandemic is to get yourself vaccinated, to protect yourself. And I want to reiterate this for pregnant women. I'm seeing a lot of pregnant women at the moment that are not vaccinated due to fear of their babies getting harmed due to the vaccine. Well, the actual reality is that the woman herself will be harmed. She's the one that is ending up in ICU after giving birth to the baby, and she's the one that is actually dying from it. So please, even if you're pregnant, this vaccine is quite safe. Get yourself vaccinated. Get your family vaccinated as soon as possible is the only message I can give.
All right, that's an important point to make. Thank you so much, Dr. Veer, for joining us on the program.
Thank you very much for having me. Thank
you. Now look at the situation in Mumbai and in Kashmir and the issues of herd immunity, which is what we were just discussing. Now 86.64% of people in Greater Mumbai area have COVID antibodies, which means they've been exposed to COVID at least once, according to the results of the Sero survey, which was conducted between August 12th and September 9th in anticipation of a third wave of infections. And now if we take a look at Kashmir, COVID antibodies have been found there as well in 84% of the population. And experts say that the high prevalence of antibodies in the population indicates that the third wave of the pandemic won't be strong in the Kashmir Valley unless there is a new strain. Well, to talk more about this, about Kashmir, we're joined by Dr. Salim Khan, Professor in HOD Community Medicine, Medical College, Srinagar. Thank you so much, Doctor, for joining us. And if you could, share with us more about these findings about the Sero survey, which means that in the second wave, quite a substantial extent of the population was affected by COVID.
We have been conducting serosurveillance since last year, May, and that time the prevalence was just 2%. Then later on we conducted a couple of more surveys and it showed around 40%. But this year, in mid of July, we conducted serosurveillance across all 10 districts of Kashmir Valley, and we found that 84% of general population was showing antibodies. We took a population of about 7 years of age, and plus we did in serosurveillance in some subgroups of population, like we did in pregnant women, we did in police personnel and healthcare providers. And surprisingly, among police personnel, the prevalence was quite high, up to 95%, because at that time of survey, almost every policeman has received vaccines, and among the healthcare workers also, around 91% had shown antibodies. Even what was more surprising for us was that the pregnant ladies who had not received the vaccines at that time, only just 1% had received vaccine at that time, because it was it all started that time, only vaccination for pregnant women. And surprisingly, 64% of pregnant women showed antibodies. What's more even surprising is that children are not getting any vaccines as of now still. But what we found that in the age group of 7 to 18 years, we found that 78% of the sampled children showed antibodies. That means the infection has been quite prevalent, and once the vaccination started, it boosts the immunity, and we can see the difference between the general population and people who have received 100%. There is definitely a gap of 10 to 20%. So vaccination has definitely helped in reaching higher levels of antibodies.
Right, and Doctor, so what does this mean for our understanding of herd immunity? Because earlier, at the start of this pandemic, there was much talk of it and how we need to have 60% of the population having antibodies. But after the Delta variant, then there was talk that it's at least 80% of the population should have antibodies. But we also know that those who have received the vaccine can get infected and pass on the infection. So what does it mean for our understanding of herd immunity? And for Kashmir, what does it mean if you're thinking of a third wave?
Herd immunity is not per se used for COVID nowadays, because people who have antibodies are still at risk of getting infection. As previously the expert talked, that if I'm not using a mask and a person, I'm coming in contact with a positive patient and he starts coughing or talking to me, the virus can get transmitted to me, and once I test it, it may become positive. So a person who is vaccinated may become positive, but the disease severity, because the invasiveness of the virus won't be there, because the antibodies will take care of. So the severity as well as hospitalization and mortality will be almost negligible among the people who have taken vaccine as against those who have not taken. So for that, we still believe that we should follow the COVID-appropriate behavior. We should keep wearing masks. Unfortunately, what we are seeing in Kashmir nowadays, more than 95% of people are not wearing masks.
That's true.
They felt that the second wave is over now, possibility of third wave is less. But still, over the last few weeks, we have seen steady rise in number of cases, especially in Srinagar. So government is coming up with more stringent actions. We believe that people follow COVID-appropriate behavior and the chances of third wave will be minimized.
And do you think we won't, everybody has said, most experts have said the third wave will be very, much smaller than what we saw during the second wave. But at the same time, there's always that fear of another variant emerging. What are your views on that?
Once we carried out the serosurveillance during July, the variant that was circulating that time was already the Delta variant. So the Delta variant wasn't that severe, but with viruses, there are always chance of mutating and we may get newer variants every time. The weaker ones die down, but if it becomes a very severe one, possibility of a third wave is always there. So we need not to be complacent with the lesser number of cases presently. We need to be more active and more receptive with regard to the number of cases coming up, and we should strengthen our healthcare system.
Right.
What we saw during the second wave, that there were some issues in dealing with the patients across the country. But we believe since then, our health system has augmented manifold. Every hospital has oxygen beds and oxygen generation plants, and it has been increased manifold. So hopefully the health system is very well equipped, and if people start following the COVID-appropriate behavior, hopefully the effects of third wave will be minimal.
All right. Well, thank you so much, Dr. Salim Khan. And yes, there's no room for complacency. I think that's the message that we need to put out among the people, even as numbers are low.
Thank you very much for inviting.
Thank you. Well, time for us to slip into a short break. Coming up on the other side, how there's a push to get women vaccinated in Maharashtra. We'll also take a look at some of the international COVID news. Welcome back. Now, as India clocked over 2 crore 50 lakh vaccine doses on Friday, Maharashtra had a moment to celebrate of its own over the weekend. The state crossed the milestone of 2 crore fully vaccinated citizens. But with vaccinations picking up pace, Maharashtra is focusing on those left behind. And Friday was a women's only vaccination day in the state. It was organized in Mumbai by the city's civic body.
A special coronavirus vaccination drive by the BMC on Friday as several state governments aimed for record vaccinations. Mumbai on Friday saw vaccinations exclusively for women at all government and municipal vaccination centres. Women got both first and second coronavirus vaccine doses to ensure that gender parity is maintained when it comes to vaccination.
Over 52% men have got vaccinated in India till now, while the numbers in women is much lesser to 47%. It is imperative that the government intervenes to ensure that more women come forward and get vaccinated.
On International Women's Day this year, the Maharashtra government had set up 5 vaccination centres in each district dedicated solely to vaccinate women. Maharashtra, especially Mumbai, has continued the effort to ensure women get vaccinated. Corporates are now joining hands with the government as it plans to reach out to each and every section of the society, especially women. This vaccination centre at the BMC school in Worli has been set up by the Raymond Group and has vaccinated 2,000 women on day one.
So we have picked 2,000 women that will get on priority. So this will help, whilst the upper segment of society has got everything, this will help the rest of Mumbai, where they are heart of it. I am a Mumbaikar and we want to do whatever we can. The only answer is vaccinate, vaccinate, vaccinate. I've said this in my interviews for several months. I've just come back from London, 3 weeks in those countries, meeting customers, etc. Their life is 90% back to normal. People are living a life, and their only answer has been vaccination.
Aditya Thackeray, who's been leading the anti-COVID efforts in Mumbai, says right from day one, corporates have been helping in the fight against COVID, and that help has extended to vaccinations too.
Public-private partnership has always existed from day one of COVID, and the corporates who are of course residing in Mumbai, have their industries in Maharashtra, have supported Maharashtra government largely, and also urban local bodies. I think this cooperation without any barriers has helped us put up jumbo centers, procure medicines to vaccination.
Women who finally received the vaccine say such efforts are of great help.
3 दिन से पौधार में गए लगवाने के लिए, पौधार हॉस्पिटल में नहीं लगा. हम लोग 5 बजे 4 बजे रात उठ के गए, फिर 2 दिन उसमें गए अपना कामगार में गए, एक दिन 12 बजे रात को भी गए लेने गए, वहाँ तो भी नहीं लगा। तो आज यहाँ पे भी सब लोग मेरे बाजू वाले बोले कि चलो उस स्कूल में लग रहा है सिपेस तक, वहीं लगवाते।
मिल नहीं रही थी, सुबह से लाइन लगा के फिर मिल नहीं रही थी, इधर आई तो फिर मिल गया इसके लिए।
India is clocking good numbers when it comes to vaccination, but for the program to be successful, it has to cover everyone, and efforts such as these will ensure that no one is left out. In Mumbai, Saurabh Gupta, NDTV.